five, it's actually six, but the first five I put down are muscles that move the scapula. Right? They're muscles that move the scapula. So watch this, guys. The scapula is on the trunk over here, right? So these muscles, anatomically, they're back muscles. They're located on the back, but functionally, since they're moving the scapula, I include them under the muscles of the upper extremity. You, especially if you guys going to, ladies and gentlemen, going into physical therapy, you may run into a class where the instructor teaches them as back muscles because anatomically they're on the back. I look at it a little bit differently. Functionally, they're moving the arm, so I consider them upper extremity muscles. So just not that you get confused. You're saying, why are they on the back? How come we didn't do these last week? And I did the back muscles. It's because, again, functionally they move the arm. They're upper extremity muscles. So that's the reason for that. What's the first one we got there? Trapezius. So let me borrow you for a second. Stand up for a second. Face in that way. So watch this. There is a muscle. It starts way up here under the occiput, and it comes down like this, and then it comes down like a diamond like that. Okay. So up here, and then down. This would be the right trapezius. Over here like this, and down, this would be the left. So it kind of has like a diamond shape to it when you look at it. Thank you. If you were doing dissection, if we had a cadaver here and the cadaver was face down, we would scrape the skin off, right? We'd peel all the fascia and the skin off. The first muscle we would see is going to be on the superficial side. Remember, guys, superficial side here, deep side here. We took the superficial muscles off. That's why it looks different, just so you don't get confused. But watch this muscle. This one up here is the upper trapezius. Then these fibers here, kind of going horizontal across. This is the middle trapezius, and then the fibers coming down the lower trapezius. So I want you to know there's three parts: upper traps, right? Upper trapezius, middle trapezius, lower trapezius. Okay. Again, it's a very superficial muscle. If you look at it on dissection, you can see it. It's a thin muscle. I was always actually surprised. I thought it would be like a really thick, heavy kind of muscle. It's kind of like a real thin muscle. All right, so upper trapezius. What's this one? Middle, and then lower. So watch what they do. The upper trapezius, when you contract it, does this. It brings the shoulders up, like when you go, I don't know, like that type of thing, like shrugging the shoulders. Actually, those of you guys that work out, right? When you work out your traps, what do? You take dumbbells and you do what? Shrugs, right? You're bringing them up, so you're doing shoulder shrugs. That's that muscle right there. This muscle brings our shoulder blades together. What's that action there when we bring them backwards? Say it. Retraction, right? Retraction. Thank you. Bringing the shoulder blades back would be retraction. Okay? And then this one will bring the shoulder blades down. It's going to pull them down. So that would be depression, right? So it brings the shoulder blades down. That would be depression, right? This would be elevation, depression. And then, like Alex said before, retraction, right? Reverse. We're going backwards. Retraction. Okay? So that's your trapezius. So on the test next week, guys, if I go like this, one sticker here, I want you to say upper trapezius. But if I put a sticker here, like this, this, and this, then just give me the name of the whole muscle. Okay? Very simple. Trapezius. Now, there is a muscle, and I don't like it on this model. I'm going to put this one down for a second. There is a muscle right in front of the upper trapezius. So just to show you here, this is on this model, this is the upper trapezius here. They're showing the middle trapezius always goes like horizontal across, and then the lower traps right here. So there is a muscle right in front, like anterior to the upper trapezius, right here. It's going to the superior angle of the scapula, and then it goes to your cervical spine. It's called levator scapulae. So let's talk about the name first. What's the action of the muscle based on the name? Levator scapulae. What do you think it's doing? Lifting the scapula like an elevator, right? Levator means to lift. Remember last week we saw levator labii superioris, right? We saw some of those muscles that had that name. So this muscle here, guys, real easy to find. Find the upper trapezius right in front of it. That is the levator scap. Those of you guys going into physical medicine, well, we've all experienced this. Have you ever had like a stiff neck where you can't move your neck for a day or two or whatever? 99% of the time, this is the culprit. So, putting heat on it, massaging it, stretching this muscle speeds up the outcome as far as getting better than if you did nothing for it. So that muscle, for some reason, if you be irritated, even like a cold draft on it, like maybe mom maybe I told you, don't sleep by an open window or don't get a draft. This muscle is truly affected by that type of thing. So, or sleeping on the couch with your head tilted in a weird way, or studying your anatomy books and you fall asleep like this because you've been studying so hard, right? A lot of times that puts stress on your levator scapulae, right? So it works with the upper trap to do this. When you're doing shoulder shrugs, you're also working your levator scap.
Is that the muscle that causes stiff neck?
Yep, that's the stiff neck muscle right there. Yep. So, where is it? Right there. I like it best on this model. Out of all the models we have, it's really easy to see there. So if I do ask you about it, we'll be on this guy right here. Like I said, if you know this model, you're going to be in really good shape. This is my favorite one. I use this one the most. Okay. So trapezius, levator scap. What's next, guys?
Pectoralis minor.
Okay. So watch this. We have a muscle on the front of the chest called the pectoralis major. It's a big muscle. It doesn't move the scapula. It actually more moves the arm. So this big, thank you. This big chest muscle right here is the pectoralis major. Underneath it, there's another muscle called the pectoralis minor. So again, this is the superficial side. On this side, they've taken the pec major off, and see this muscle right here? It's kind of going from the second to the fifth rib. Back a little bit. Right here, going right to the front of the scapula. Remember that little bent finger called what was the bent finger? Coracoid process. This is actually going to the coracoid process. When this muscle contracts, it rolls our shoulder forward, right? So it actually brings the shoulder forward. What action would that be? Bringing the shoulder back was retraction. Bringing it forward was protraction, right? So this muscle is a protractor. It brings the scapula forward. Right? Sometimes when people have like tight pec, come up closer so you can see everything. You can see it back there. When people have tight pec minors, they have like rounded shoulders. People that are hunched over all the time, so their shoulders will be forward like this because the muscle's contracted, so it kind of pulls it forward like that. So they kind of have this kind of closed up appearance. All right, so that's the pec minor. What muscle is it underneath? Pec major. You're not going to see it unless you take that pec minor off. Pec major off. Excuse me. Okay. Serratus anterior next.
Yes.
Okay. So watch this. There is a muscle right here, guys, on the side of our ribs. It's like out here, the lower 8 or 9 ribs. Then it does something interesting. It starts here. It goes under the scapula, and it comes out here on the vertebral border of the scapula right there. Okay, so it actually goes from the rib cage under the scapula, and it comes out on the vertebral border, and it kind of grabs the vertebral border. When this muscle contracts, it takes the whole scapula and also pulls it forward. So it works with the pec minor to do protraction. This big muscle here is called serratus anterior. The reason they call it serratus, think of a bread knife. Right, you have a bread knife at home. What kind of knife is that? It's a serrated edge. It's got that rippled appearance. So when the anatomist looked at it, and this to them had a serrated edge to it right there. So they called it serrated, right, for that reason. So it kind of looks like a bread knife type of thing as far as the knife part, right? So that's the serratus anterior. Powerful muscle, brings this whole scapula forward, but you can only see it here. We would have to actually take the scapula off in dissection to see the whole muscle. So we kind of lose it under here as it goes through the armpit underneath the scapula. But it comes out again. I don't know if I'm on the vertebral border, I can't see it. Like right here, it would come out here. That's where it attaches to. Then when it contracts, it just takes the whole scapula and it pulls it forward, okay? So pec minor and serratus anterior both do the same thing, right? They're synergistic in protraction, right? They're protractors. Okay. the last two muscles, I think I probably put them on one line, right? They're called the rhomboids, rhomboid major and rhomboid minor. So they are right underneath the trapezius. If we were doing dissection again on our cadaver, we would cut the trapezius, reflect it back. So we would cut this muscle off here, and then right underneath it, boom, right here, 1 and 2. They're kind of like under the middle traps, kind of in that location. This top one, the smaller one and thinner, rhomboid, rhomboid minor. The bigger one underneath, rhomboid major. Okay, they're both underneath that middle trapezius, so they do the same thing. The fibers kind of run the same way. These also do retraction. Right, so your rhomboid minor, your rhomboid major are retractors. Right, they bring the muscle back in reverse. Okay, so again, functionally, these are upper extremity muscles. Anatomically, though, they're located on the trunk. Right? Anatomically, they're located on the trunk. Any questions on those? Retraction. They both do the same thing. Retraction. Thank you. All right, so let's review for a second. Identify this muscle up here specifically. What part? Upper trapezius, right? Upper trapezius. Identify. Oh, I can't even see from my. This specific muscle right here. Major rhomboid or rhomboid major. Good. Identify on the side of the chest this muscle here. Serratus anterior. What does it do? It pulls the scapula forward. What is that?
Protraction.
Protraction. What muscle works with it right here? Pectoralis minor. Good. Pectoralis minor. Awesome. In front of the upper trap, like I said, I don't like it on this model here. This would be it right here. I like it better on the other model. What would be the muscle in front of the upper trap? Levator scapulae. Excellent. Levator scapula. What does it do? Lifts up the scapula, just like the name says. Right? Very, very easy. Okay. That side. Okay. So let's take a look at the rest of these muscles, guys. We're going to find on the arm model. Okay. So what this is a little bit as far as telling the front and back. Remember, like with the leg, I made a big deal out of recognizing the front and the back, inside, outside. This one's pretty easy. What this dissection is this. They've taken the arm, right, and we've kind of dissected it this way. So this is the position that we're looking at. The first group I want to show you is called the rotator cuff group. The rotator cuff muscles. A lot of times we call these muscles the sits muscles. S-I-T-S. And that's the way I put it down in your notes. If you remember sits, you'll remember the order of the 4 muscles. The first muscle is supraspinatus, infraspinatus, and teres minor, and then the subscapularis. So, let me show you real quick. This is missing. All right, we're missing something here too. Okay. This is the shoulder area. We're going to see this big muscle here. Anybody know what this is, just off from what they know?
Deltoid.
The delt, right? This is the deltoid muscle. This is the spine of the scapula right over here. So what I want to do is I want to take the deltoid muscle so we can see the spine of the scapula, and I'm going to do it on this one over here. So on this model, we've taken the deltoid off. This is the spine of the scapula. Here's the vertebral border of the scapula, inferior angle of the scapula, right? Just kind of to give you some bearings. So the first muscle is supraspinatus. This is the spine. What does supra mean? Above. So this muscle right here, guys, above the spine of the scapula, it sits in the supraspinous fossa. This is the supraspinatus. Supraspinatus. The second one is infraspinatus. So go back to the spine of the scapula. Infra means below, right? So watch this. This whole thing here is actually 2 muscles. The 1, 2, These three bellies here all are the infraspinatus. The fourth one down here, this one, this is the third rotator cuff muscles, teres minor. Okay, so supraspinatus, S, infraspinatus, these three bellies right here, that's your I. T is teres minor. Don't get it confused. There's a teres major. That is not a rotator cuff muscle. That is not going to be considered a rotator cuff muscle. Only this one here. So teres minor. The fourth one is the subscapularis. Where was the subscapular fossa when we looked at the scap? On the underside, right? We had to actually turn it around. So watch this, guys. If you turn the whole arm around, this is the underside of the scapula. This big muscle here that fills the hollowness of the subscapular fossa is our fourth rotator cuff, subscapularis. Okay? One more time. What's the S? Supraspinatus. I. Infraspinatus. T. Teres minor. S. Subscapularis. So if you remember it that way, again, always use your spine of the scapula as your reference point. The name tells you where to go from there. It's so easy. Okay? Anybody with the rotator? Again, those of you going into physical therapy, any one of the muscles of the rotator cuff can be injured. Most commonly, the one that's injured is the supraspinatus muscle. A lot of times, athletes, for just variety of reasons, will tear this muscle here right as it attaches to the humerus, and a lot of times they'll have to have surgery. You can actually see the tear on the on an MRI. So supraspinatus is the one that you're definitely going to deal with if you're going into physical medicine.
Can you see
Go.
And you say all four are what? Rotators?
Rotator cuff. Yep, I even put it there for you. Where is it? See the rotator cuff group? Yep. So we just call it the rotator cuff
Can you
group.
see the subscapularis from here too?
Not from the back. We wouldn't be able to see it from the back. The only way you're going to see the subscapularis is you got to look at it from the front. That whole muscle, it's a big muscle, is subscapularis.
So all of it?
The whole thing. It fills up that whole subscapular fossa, the whole thing. Okay? Anybody else? Okay. I'm just going to put this over here for a second. Can you see your notes okay?
Yeah.
Okay. You pull it out just a little bit. Sorry about that.
That's all right.
All right. Let me get the big guy one more time. This here. What I have next? Pec major?
Yeah.
Okay. So watch this, guys. The pec major, easy muscle to find. I just want to show you one thing on this. Let me move back a little bit. The majority of the pec major, what bone is this right here? The sternum. See how it attaches to the sternum? It's a big muscle. It comes all along your sternum here. Then it goes over from here to your, over like by your bicipital groove. Remember that little groove between the greater tubercle and the lesser tubercle? It actually crosses over the bicipital groove and it attaches right there. So you can see the fibers coming this way. So the majority of it comes from the sternum, but also part of it comes from the, what bone is this over here? The clavicle bone, right? The clavicle. So see, part of it comes from the clavicle. Then they unite right here to attach to the arm. So this is the pec major. This type of torso is what I'm going to use. This, the little torso. Hold that little guy up for a second, just to show you. These torsos here are really anatomically pretty good. On the his right side, that's the pec major. On his left side is the pec minor. So make sure you look at those torsos too. But the reason I'm showing you this is because on the arm, part of the pec major is there. Watch this. This is the clavicle. This is the part of the pectoralis major coming from the clavicle. This part here they've cut. This is going over to the sternum. So this is part of the pec major here. Sometimes it throws students off. They're trying to figure out, where does this belong? What is it? That's why I wanted to show you on the big torso first. This is the part coming from the clavicle. We call it the clavicular head. I probably won't ask you the pec major here. I just wanted to explain to you what it was. Please know it on the torso, however, okay? Anybody, questions or comments on that? Everybody's clear? Okay. Pec major. What's the next one?
Deltoid.
Deltoid. All right, so that we saw, right? That's a nice, easy one. This triangular muscle here goes down, right? This is the deltoid tuberosity on the humerus, right? We had looked at that when we did the humerus bone. So that's the deltoid. The next muscle I should have on there is the lats. So last time we're going to bring this guy up. Watch this. On the back, underneath the trapezius. Again, if we were doing dissection, we had the cadaver face down, and we were tearing the skin off and stuff like that, we would see the trapezius right underneath the skin. But once we got down over here, we would see another very broad muscle right here. Here's it. Remember, this was the trapezius, right? This was the lower trapezius. This big muscle here, guys, that's right on our back. This is called latissimus dorsi. But even though it's on the back, what it does is this muscle comes up, it goes through the armpit, through the axilla, comes around to the front of our arm by the bicipital groove here, right? The pec major came onto this side, this one comes to over here. So it actually moves the arm when you contract it. This is the main thing that it does. I always say the handcuff position is the action of the lats. Watch what it does. It brings your arms back in extension, then it turns the arms in medially, and then adduction, just like handcuffs, right? You're being if you handcuff. So extension, medial rotation, adduction. That is one of the major things, those three things is the major things that the lats do. So if you just kind of write down the handcuff position for the action, it's pretty easy to remember. Okay? But where do you find it? Look at this. It's a massive muscle right here. Look at that. Look how big it is. And it's right under the skin. Right? So it's a very superficial muscle. If we were doing dissection, we would see the lats, the traps and the lats. Traps above, the lats below. Again, like I said, right underneath the skin. Okay? Latissimus dorsi. You do see it here. I just wanted to show you also. Sometimes students look at this. There's a little tendon here running through the inside of the arm. This is the tendon of the latissimus dorsi right over here. I won't ask you on this model. I just want to explain to you when you are studying this and you're looking at it. That's what that tendon is right there. The majority of the lats you're going to see over here. But like I said, it does run through the armpit to make its way to the bicipital groove in the front. So that is your lats here. Okay? So the pec major and the lats, I won't ask you on this model. I'm more likely to ask you on a torso, just so you know. Anybody, questions or comments? Okay. Teres major next? Okay. So, the next muscle, when I used to teach like a myology class, I would just teach muscle classes. We would call the twin to the lats. It's called the teres major. I used to call it the twin to the lats. The reason for that is it kind of runs right next to the lats, and when it contracts, it does the same thing. What was the action of the lats? What position? The handcuff position. So that means the teres major also does the handcuff position, right? It's the twin to the lats, puts you into that handcuff position. So let's find this one. Actually, go here. Watch this. We'll take this guy off also. So this was the teres minor, right guys, over here? The muscle below it, bigger, teres major. Again, watch the way of identifying it. This tendon here that comes up is from your triceps, the back of our arm. This is called the long head of the triceps. It always divides the two teres. It always separates the two teres. Teres minor is separated from the teres major by this tendon here. So if you get a little bit confused, which is which, or you know what's what, again, when I was in your position, what I always did was I looked for the triceps tendon. I saw that it split the teres muscles, right? So the smaller one would have to be the minor, the bigger one would have to be the major. Okay, so again, whenever you see that division, these are your two teres. This one's the teres major. Is it a rotator cuff muscle?
No.
Does it rotate the arm? Yeah, but it's not a rotator cuff muscle. Only the teres minor is the rotator cuff muscle. All right, so on the test next week, if I just said to you, list the 4 rotator cuff muscles, you're gonna put down supraspinatus, infraspinatus, teres minor. Okay, again, that's a common mistake. It's the only reason I'm pointing it out. I see it all the time. Okay? So I don't want that to happen to you guys. Teres major. What do we got next? Okay, thank you. Watch this. The next 3 muscles are in this compartment right here. There's only 3 muscles in the front of our arm, right? Remember arm, forearm, right? So only 3 muscles in the front of the arm. Let's do it out of order for a second. Watch me, guys. Ignore your notes for a minute. So the first muscle right here is the biceps brachii. Why do I have to say brachii? Because there's a biceps what? Femoris, down in the lower extremity. Remember we said the biceps femoris last week was the lateral hamstring muscle? Right, so you want to review that today also. Very good. So we got to say now biceps brachii. We can't just say biceps anymore because we know that there's 2 biceps. So the biceps brachii, if we pop this off, which we can't on this model, guys, there's a muscle right underneath it. We can see the edge of it here. This is the brachialis. So biceps brachii is superficial to the brachialis. I have another model, it's in the other room. On that one, I can pop the biceps off. If you want to see the whole brachialis muscle, you can take a look at it. Just let me know, I'll go get it for you. But on this model, this would be the brachialis. We don't see the whole thing. So biceps brachii, brachialis. On the inside of the arm, there's a tube-like muscle right here. Not the yellow thing. These are nerves, but this tube-like muscle right here goes right along the biceps and the brachialis. This is called the coracobrachialis. Again, you guys going into physical therapy. It goes from the coracoid process, coraco, to the brachium, the middle part of the arm, right? So they call it coracobrachialis. It's like a little tube-like muscle right over here, okay? So what's this muscle on the front? Biceps brachii, right? We got to say brachii. Muscle deep to the biceps brachii is the brachialis. The tube-like muscle on the medial side of the arm is the coracobrachialis. That easy. Okay. Okay. What do I have next? Tries? Do I have Anconius there too?
Yes.
Strike Anconius. They don't have a good model of that. Take off Anconius, guys. Small little muscle. On a lot of people, it's not even there. It's one of the muscles that sometimes we don't have. So we're going to take that one off. On the back of the arm, I only want you to know one, and that's the triceps. Right? We do the triceps. So watch this, guys. Just to give you a little bit of perspective. So we're looking at kind of like the back of the arm now. This is the prominence of the elbow, right? Watch me use the point, guys. Pointer right there. What's that? What is that bump? Elbow, but yeah, what part of the elbow is that specifically? It's part of the ulna, the prominence on the back of the ulna. What region is this? Olecranon process. Good. This is the olecranon process, just to show you what we're looking at. So you'll see the tricep muscle comes down and it attaches to the olecranon process. So this is the olecranon. So tri means what? 3. Has 3 heads. The head here that bisected the teres was the long head. So that's the one head I want you to know. That's long. Then on the outside of the arm right here, this is the lateral head. So this one over here, all of this is the lateral head. And then if we look on the inside of the back of the arm, this one down here, little dude right there, this is the medial head. Long head. That one's the easiest one to find because it cuts the teres in half. Lateral head is on the outside of the triceps. Medial head on the inside of the triceps. Okay? So same thing, next week on the test, if I just have the sticker here and I say identify the muscle, you gotta say long head. But if I have a sticker on all 3, then I just want triceps. Okay? I'll try to lead you in as far as what I want on my questions, just so you know. Anybody, questions or comments? All right, Anconius you struck, right? We take that one off.
Yes.
Okay. The remaining muscles are the anterior forearm. Let me just see one thing. I gotta update this one more time next semester. This